For me personally, it started out when I was very young and I saw plastic surgeons repairing cleft lips in third world countries, and I just thought that that was something that was an incredible way to use your skills to be able to change someone's life. But after sort of the whole intrigue with that, I found that the biggest motivation was the people I worked with and other plastic surgeons, and realizing that I really got along very well with them, and it really felt like I just belonged with them. So, and I think that in general, when choosing a specialty, that is a lot of what we do. We sort of tend to migrate towards people who are similar to us. So I think that's where it came from. I think what I find most rewarding about it is really the same as what I found so intriguing about it at the beginning, that you could take someone who had a very obvious deformity before you worked on them and be able to create such an instantaneous change for them. So a lot of what's so rewarding for me is to start an operation and be able to, by the end of the operation, see exactly what I've done for them. So I think that that is, unlike some other surgical specialties where you might be working on the bowel or you might be doing something inside the body, it's not so visible. And that's what I find so rewarding, to be able to finish and see exactly what I'd accomplished. Well, these days, going into plastic surgery is probably one of the most competitive residencies that you can get. And I think that what most residencies are looking for in an ideal candidate is, unfortunately, the best medical students that they can find. I mean, there are the top board scores are really, some of the top board scores are really interns, or excuse me, medical students who are applying to plastic surgery programs. So first and foremost, we want to see evidence that someone is just very, very bright. And unfortunately, one of our best ways to determine that is to look at their board scores. Also, most of the plastic surgery training programs, at least the integrated programs, are in academic centers, and most of those programs have faculty who do quite a bit of research and do quite a bit of academic and scholarly work. So we also like to see, again, people similar to ourselves and people who are also doing academic work and are interested in research, whether it's basic science or clinical research, but at least have an interest in those kinds of academic endeavors. And of course, we want to get along with them as well. So it's not that much different from other specialties, except for that I think that the threshold is unfortunately quite a bit higher to get into these programs because they're very competitive. I think plastic surgery is a wonderful field for anyone who wants to have the flexibility to spend quite a bit of time with their family. I have 2 children, and I've been married for 6 years, and I pick up my children from the daycare center every day. That is something that I probably would not be able to do if I were a trauma surgeon or if I were a general surgeon, but that is the life I've created and the practice I've created for myself. Certainly if I chose to be a plastic surgeon who did hand surgery or did some other aspect of plastic surgery that requires more time, has more emergencies, it might not be that flexible. But the nice thing about plastic surgery is you can design it to be strictly an elective practice if that's what you want, and if you want to have the flexibility to be able to spend more time at home. One of the biggest challenges about being a plastic surgeon is, I think, a lot of people seem to think that they can do what you do. So there are emergency medicine doctors and family medicine doctors who can order Botox and feel that they can inject Botox. There are, rightfully so, on another hand, ENTs and other types of head and neck surgeons who can do facial cosmetic surgery. So there are actually people who are not only trained to do the same things that you do, but there are people who are not trained the same as you who think that they can do what you do as a plastic surgeon. So I think that is really one of our big challenges. The other part of it is that oftentimes what plastic surgeons do is considered cosmetic, and in the eyes of the patient, what they're having done isn't necessarily cosmetic elective. So another challenge is really a struggle with insurance companies to get procedures that I see as medically necessary actually covered by the insurance company. So a big challenge is really just negotiating the insurance system and getting your operations paid for so that your patients don't have to pay out of pocket for a medical operation, really. I think what students need to know is what plastic surgery is. I think there is definitely a perception that plastic surgery is just cosmetic surgery. It's just the facelifts, it's just breast augmentation, it's just tummy tucks, but it really isn't. It's plastic and reconstructive surgery. So I think students are often amazed when they rotate with us that, at least in this academic center, most of what we do is reconstruction. So we do breast reconstruction and lower extremity reconstruction and chest wall reconstruction, and we might do an occasional breast augmentation or some liposuction in between, but most of what we're doing here is reconstruction. And I think that there's a perception out there that plastic surgeons are just doing cosmetic surgery, and that's just not true.